importantly, does it go far enough, and who's going to end up paying for this?
The users of the system are going to pay for this system. Right now, there's a $1,000 tax on most people's health insurance policies because of the uninsured people in this country. In California, it's even a little bit higher, according to Blue Cross and Kaiser and others who look at these health care costs. This is a very important piece of legislation because this brings health care security to millions of American families. Never again, and for the young people listening to this, there's going to be an economic up and downs, but never again will you lose your health care if you lose your job. Never again will an insurance company tell you when you announce to them that you need treatments for cancer, they're going to take your policy away. Or they're only going to pay $10,000 and then you're done. Or they're only going to pay a lifetime limit of $200,000 and you're done. Never again are they going to kick your kids off because they turn 19. Even though they're not sick, they're among the healthiest part of our age brackets in this country, but they could kick them off. Starting Monday of next week, open enrollment in Kaiser, your children can come back onto that policy until age 26. These are huge changes for working families. These are huge changes for the economic security of people in this country. I'm very proud of that legislation. We've already saved, just in the enhanced waste and fraud provision, one of which I wrote after the 60 Minutes piece, since the enactment of the legislation, over $2 billion has just been collected in waste and fraud, and I think there was another major announcement today about a sting operation for people who abuse this system. So this makes fundamental changes, but it brings people into affordable care, and it keeps that care available to them, accessible to them. 50% of the bankruptcies in this country are impacted in a major way because of a medical event that a family or an individual simply could not handle. They could not handle it. So what did they do? They started to put it on their credit card. And then we know the rest of the story. Families should know that they have the financial security, that the medical care will be there for them, their spouse, their children, their parents, when they need it. It's an absolute hallmark of economic security in this country. And we've provided small businesses are getting the tax credit this year before the plan ever starts. That tax credit goes up to 50%, and it's going to be a system that's going to be a great help to millions and millions of Americans. Remember what the trend was before. The trend was before companies were getting rid of health insurance. They were putting more and more cost onto their workers and to their families, premiums, co-payments, deductibles, and that was the trend. Small businesses weren't offering. It's been going on for 10 years. These businesses have been coming saying, something has to be done. You cannot continue this way. They wanted this as much as anybody else. They wanted this as much as anybody else. Now it's very interesting in the polls as the people learn more about it. A majority of the people now support it. It wasn't very popular when we passed it. It wasn't about being popular. It was about doing something for